Undeniably, Leicester Medical School is one of the best in the country.
Our students are active, interested and committed future healthcare professionals.
The good thing about the medical school in Leicester is it does change. It doesn't stand still.
We are creating doctors for the future. We want to create the very best doctors in practice.
My medical school team are phenomenal. They sincerely care about the students. I think the students pick up on that, and that translates into a sense of responsibility and commitment to their future careers.
I think we should be justifiably proud that we produce doctors from the broadest spectrum who can relate to the patients they treat, are empathic and are focused on delivering positive outcomes and improved quality of life for patients and their families. And we should never lose that core value.
Leicester Medical School is known for involving real patients and carers in student learning. And our role is to tell stories, our experiences to the medical students and bridge the gap between theory and practice.
Leicester Medical Society is one of the oldest medical societies in the UK. Our aim is to increase our impact on mentorship for the young generation of doctors.
One of the things that we've continued to do is to think about where we are on the international stage. So I presume our two key ones are Chongqing Medical University. The advantage for our students is that they leave with 2 degrees, a clinical medicine degree in China and a clinical sciences degree here. They have the opportunity to have a year here, so they really get embedded in the culture of Leicester and the UK. The other more recent partnership is the Apollo Healthcare Partnership. The two key things from the perspective of the medical school is firstly research opportunities with the Centre for Digital Health and Precision Medicine, and opportunities for Apollo doctors to come and work here in the NHS but also study here at the university in terms of their higher qualifications.
Our medical school, and I'm very proud of this fact, has been ranked first amongst medical schools in the UK in the National Student Survey for the last 3 years. We couldn't achieve that without strong partnership with our NHS partners. They are superb contributors to our student education, both in terms of placement provision, but also in the members of staff who help teach our students. And we could not be so successful without them.
So over the last 4 years, we've really put personal commitment into strengthening our relationship with the university in various aspects, such as jointly signing up to taking more medical students, but also working together to ensure that the medical students have the best possible experience when they're on placement.
From my experience in the NHS, I think our relationship with the University of Leicester was fantastic. By working together in partnership, we can shape the attributes that those doctors bring to our patients. Really, really important to have high quality patient care. The students get to see that when they're on placement and really understand the practical side of being a doctor.
I think it's a symbiotic relationship, and I think that's why it's so healthy and so beneficial. I think the opportunities for research and clinical trials and working on clinical trials in a real-world environment, I think is extremely important, and there's a lot of ambition and excitement about the opportunities for the future.
To be in an institution that teaches the next generation of healthcare practitioners, but also exposes them to the importance of research and its positive impact on health, I'm very justifiably proud. We are first for student satisfaction. We are second for clinical medicine research. There will be not many medical schools that can say that ever, never mind in such a short time frame as 50 years.
Research in any medical school requires people who got bright ideas and wish to do things, making new discoveries. And I think Leicester, in many areas, including respiratory health, cardiovascular health, diabetes, we are well leading.
Medical research in Leicester is unequivocally strong. There are some breathtakingly good translational researchers in Leicester. The faculty make an enormous contribution. Everybody should be very proud.
In the last 50 years, the University of Leicester has trained outstanding doctors and provided really impressive medical education. It's also contributed substantially to UK health research to improve diabetes, heart disease, cancers and many other diseases, both in the UK and internationally.
I think a really important role of established medical schools is supporting new medical schools, and we've done that on a number of occasions. Our most recent partner is Bolton Medical School at the University of Greater Manchester. They very much have an ethos around widening participation. So a lot of their core values reflected our core values.
I think the support that we have had is in all aspects, from the strategic aspects in terms of developing a new medical school to the actual operational aspects. We view LMS more than just a contingency, but as a partnership, and we look at your journey with admiration and want to follow.
Honestly, I'm so glad, I'm so indebted to Leicester Medical School, because Leicester reminded me there's a massive human element to this, and I couldn't have done what I did for the rest of my life without really having that drilled into me. After doing some years in the NHS, I ended up moving to India to do some volunteer work. But the more we were there volunteering, using our skills in areas where there wasn't medical care or childcare, really impacted us. And so we ended up setting up a charity called Love the One, and it is a children's medical charity where we do holistic projects. So they didn't just need medical care, they needed people to look at them going, there is a child, they have human rights, what do they need for them in their generation to break the poverty cycle? And then we ended up setting up a school, and then a school for children with disability, and so on. It went on like that. It was like, yes, they got medical care to save their life of their malaria, but they got so much more.
My one message to future doctors: make your patients your first priority, but don't forget your own health and well-being as well, because the more you can look after yourself, the better you can look after your patients.
The patients that are in front of you will be vulnerable, and it's a time when they need you most. So always, always think about that.
What the medical school should prepare you for is that ability to assimilate new knowledge, to be able to use it to treat your patients.
This is an amazing career. You've got the opportunity to head in such a multitude of directions. There will be an area where you can absolutely fulfill your potential and make a real difference.
Treat everybody the same, treat everybody with respect, and ensure that everybody feels that that's the first time you've given that advice out.
Have a holistic approach to patients and carers, and we want you to become the best doctors.